So, I'm hearing that you are anxious about your child's development and the possible delays that could be going on. So, in order to see if your child has these different delays, you can go to a healthcare provider and they will do a screening for you. Within this test, it will determine which delay, if there is any. So during this test, the child care provider may ask you questions as the guardian. They will have you talk with the child and play with the child to help determine the way that the child learns, speaks, behaves, and moves. So that's just determining which style or different type of delay they have. So within the delays, there's cognitive, motor, social, emotional, behavioral delays. So those three are all grouped together. And then speech delays. So with the cognitive, it has an impact on the intellectual development. So it impairs awareness. So it often shows up at the time that children start in school. So around the 5 to 8 year mark is normally when you are able to see it and determine it. So children who often have a brain injury as a result of illness, like meningitis, it swells the brain and may experience this kind of delay. It won't happen to everyone, but it is a big possibility. This can happen due to shaken baby syndrome, epilepsy disorders, and genetic diseases. So, if the child has Down syndrome, there might be a greater chance, or it might be a signal. There isn't really any way to fix this as of right now. So, if you catch the disease, there is stuff to help with the disease, but with the cognitive delays, there isn't really a way to fix it or fix it before it happens. So with the motor delays, it's the ability between the major muscle groups, like those found in the arms and the legs, and the smaller muscle groups, such as the hands. They're tampered and they can't work properly. So it can start as an infant. If they have difficulty rolling over or crawling, this is sort of a sign that they might have a motor delay. So for older children, it shows up as clumsiness or difficulty climbing, descending stairs. Individuals with difficulties in fine motor skills may encounter challenges while grasping small items or toys. So if they're trying to pick something up, there might be a difficulty with that. Certain genetic conditions, such as ones that shorten your limbs because they affect your muscles, are things that are causing of the motor delays as well. Because if your muscles and your ligaments aren't the same length as the rest, it can cause some problems and impediments. So, yeah. And then with the social, emotional, and behavioral delays, it's presented in children neurologically. So, children who have diagnosed ADHD experience the social, emotional, and behavioral delays. Autism is also on there. They may interpret information or respond to their surroundings differently than a child whose brain functions correctly at their same age. The learning, communication, and social skills of a child may be impacted by these delays. So, children who experience these developmental delays frequently have trouble with social skills. So, individuals could struggle with recognizing social skills, like engaging in discussions. So, in a two-way conversation, they wouldn't want to start the conversation. Or in the middle of a conversation, they may not know how to respond correctly. They also might find it difficult to cope with any frustration they have. So, they may throw extended tantrums or require more time to calm down than other children who may be experiencing the same thing. This behavior could suggest that the child requires extra assistance to change in his or her environment or acquire like the coping skills that they need in order to help with the emotional social difficulties. So with the emotional and social and behavioral delays, there is more that we can do to help out with that. So studies have shown that changing the environment even a small bit can help with the social and emotional and behavioral. So socially, if the child goes and talks with someone, they can build up their talking skills, and then they can start becoming more social and being able to talk to more people. With the emotional aspect, there are ways that people can go and help their child with their anger or help get their emotions out. And then with behavioral, it's the same thing as emotional. There are ways and places that will help your child, or you yourself can help your child calm themselves or start creating a better behavioral system. And then we have speech delays. So some language delays include repetitive language disorders. So they have difficulty understanding words and concepts of words and sentences or basically anything. So children with this type of language delay might have difficulty recognizing color, body parts, or shapes. So another type of language disorder is expressive language, where the vocabulary declines for age and complex sentences are spoken. So children with this type of language delay may babble or be slow to speak or form sentences. Children with language delays often have a combination of receptive and expressive delays. So children with oral motor disorders that affect speech production, such as weakness in the muscles of the mouth or difficulty moving the tongue or jaw, have a condition called speech production disorder. This is also under the speech delays. This can occur due to an injury, but this can also be kind of genetic. So children may experience language delays due to psychological causes of brain injury or genetic syndromes or even hearing loss. So other language delays are caused by environmental factors such as a lack of stimulation. However, in many cases, the cause of a child's language delay is honestly unknown. So with all of these different ones, there is a way that you can go and get tested to determine if your child is experiencing one of these delays. So if you are seeing the symptoms, or you are looking at your child, seeing they might be experiencing one of these delays or multiple of these delays, you can go into your healthcare provider, have your child go through the developmental testing, and they will surely be able to help you better look and see what kind of delays your child could be going through. Or maybe if it is something that is not to be worried about and it's just for the time period and they're learning it currently. So I really hope that helps, And I hope that I could help you out a little bit by helping you learn about these different delays. I hope you have a wonderful day, and I hope you are able to figure this out soon.